Asema kuna amevaa koti la orange I think kwa hiyo Zefe. Alafu kwa ile medical camp
so long as there's
by the end of functions zetu zote tu tunatumia hiyo.
So tunaandika tu hapo SJAC digital, ndio?
SJAC tu.
Hata niulize just in case naweza nikaenda Tokyo, hata naweza nikatumia microphone
ya SJAC hiyo itatupatia mileage. Medalini.
Sasa leo ndo msema kweli bana. Nataka kwenda kukampu. A very special day for SJAC because we always work without checking our health, and health is wealth. There's a say that goes like health is wealth. So without good health, you can never make money. So this is a very important occasion today. It's the first one, and we are very happy. The turnout is very good, and we are happy with our new partners. We have 4 partners today. We have Westland Specialist Hospital. We also have House of Dentistry. We have Restore and Renew Wellness Group, as well as a Holistic Weight Management Center. So these guys came together today to offer us a lot of services, which include high blood pressure screening, prostate cancer screening, as well as breast cancer, dentists. We have our dentists here for dentistry and all that. We have also mental wellness, which is very important. So it's a great day for us, for sports journalists. And I think we can maintain this from our discussions. We can have it maybe twice or thrice in a year. We'll also be having virtual sessions with the mental guy, because there's a lot of stress in sports journalism. Remember, we are very passionate because by the nature of our career. For example, supporting Harambee Stars, you are a journalist, you see the team being knocked out at the quarterfinals with a dubious goal, very painful. it affects many guys, but guys may take it lightly. There's also redundancy affecting so many people. So mental health is very positive for our members. Yeah.
The process here costs huge sum of money, but for sports journalists, due to this partnership,
Yes.
it's free of charge.
Yes.
What can you say about that?
Yeah, it's a very positive thing because you see all these tests are being done for free, and according to these medical practitioners, they're saying that this test costs more than 30,000 shillings, and for sports journalists, they're being done for free, totally free. So it's a big opportunity for our members, and this is how we cut. The practitioners today made all this free for us. You've seen the list of tests they're offering, which is very expensive. If you go to the hospital, it will cost about 30,000 shillings. So here they're doing it for free. So this is one of the ways we are using to empower our members, because it's totally free, and it's good to know your status of health so that you can know the next step forward.
Thank you so much. My name is Indakwa Jackson, Director Sports, Ministry of Youth Affairs, the Creative Economy and Sports. And I would like to take this opportunity to applaud the Sports Journalists Association of Kenya for reaching out to make sure that there is this event here. Also want to thank the Westlands Specialist Hospital and all other partners for giving us this opportunity to come and find out more about our health. You know, the sports journalists do a lot of reporting. They report about our athletes, our sportsmen and women. They report about the results that have taken place during the various competitions. And they do the necessary follow-up on our athletes and sportswomen during their active careers, during their sunset years, and so on and so forth. And the issues of health are very key. As you all know, you've got the opportunity and the space to educate our sportsmen and women on how they can be able to take care of their health, mental health, checkups. The athletes normally encounter injuries, how they can manage their injuries during the competitive times and even after the competition. So I think this is a very good opportunity for us just to interact, get to know what the institutions can offer, so that we can also be able to relate the same information to our sports persons. We have more than 138 sports federations here in Kenya dealing with the youth, the ladies, the men, the veterans. The veterans take into consideration the older persons that are still active and competing for this country, various competitions. So this is a good venture where all our sports persons can then be able to benefit. And the most ideal person to convey this information is the Sports Journalists Association of Kenya. Yes, that is true. There are many other opportunities where we can partner with the Sports Journalists Association to just educate our athletes. We have our national teams going out to various competitions. Of late, we do not just engage the coaches only. We engage the coaches, the nutrition experts, the psychology experts, so that as we prepare the teams for these events, then they can be able to benefit from all those angles. The Agnes Tirop Foundation, as you rightly say, we've had a lot of gender violence affecting the athletes, especially the ladies. We have lost a number of athletes in this country, and we also, once this happens, of course there are psychological effects that come to it. and this affects the athletes, the colleague athletes, the parents of these athletes, and so on. So we all need these services as a cross section. So this is an area that we can continue to partner with, and we hope we'll be able to partner so that we can get the professional services coming to this athlete.
I am the CEO at Restore and Renew Wellness Group. We are in the wellness, mental wellness space, and literally our work, we are based at Luton Hospital. That's where our clinic is, on the 3rd floor at the Doctor's Plaza. But our partnership with the organization today is to support them on a mental health journey. We know as journalists, every time when we watch the news and everything, and sometimes as members of the public, the shock that we get at some of the scenes that they're trying to cover and so on. And so in our work as mental health specialists, we ask ourselves, who literally takes care of them after this is all said and done? And therefore ours today is just to be here for them, that after they've seen all this, they've handled the things that they handle, the stress at the office, and they also have families that they also need to deal with, and all the other things that life brings along the way, that will be there to be able to support them mentally, be able to look at the levels of stress. Do they need to see doctors? Do they need to just be talked to? And when they get back to the offices, how are they able to still stay safe and also comfortable working along with other members of that literally mental health is just like any other disease. The way you wake up and you have a cough, the way you wake up one morning and you have high blood pressure, or you have malaria, or you have TB and so on, and you need to go for help, that's exactly how mental health is. That every day, and actually this is an everyday thing that requires to be supported. And people think for the longest time there's been a lot of stigmatization around it. But look at it, you go to sleep and you wake up in the morning, a child has been sent away from school, or one member of your staff has not reported. It brings stress because you're now trying to deal with something that you're not prepared for. So just like every other illness, mental health is an illness that requires professional support, and we request that people take it seriously and go and look for help. Okay, what happens when you walk into a mental health or a health facility? The first thing is we want to find out what are you, what does your pressure say about you, your sugar levels, and then after that, also we want to know about your dental, is it everything okay? Then mentally, where are you? So on the mental health, then now we'll be here, the machines will talk to you. But when you get to mental health, is one-on-one. We need to find out, have a discussion with you, get to know exactly where you are for us to be able to give you that help. Yeah.
My name is John Mark, Business Development Manager, Westland Specialist Hospital. So today we are thrilled to partner with the Sports Journalists Association of Kenya, just to make sure that their wellnesses are being covered in as much as they are doing this stressful job of covering the news from whichever part of the country. We are more than glad to be here for this noble cause. Westland Specialist Hospital is a level 4 facility based in Westlands area. We have facilities like ICU, HDUs, even major theaters. We do all those sort of technical medical advances. We also offer emergency response. That's why you can be able to see the ambulance behind my back here. So we are here to just make sure that your wellness is being catered for in terms of emergency responses. Yeah. I know you guys are, as Daktari had mentioned, you cover stressful events, and therefore we need to make sure that you guys are fit whenever we are called upon to cover news. You run around everywhere, and as a healthcare facility, we need to be present wherever you are. Personally, I'm not a Gen Z, but I will tell them that they should live well, they should eat well, and probably exercise more. And as Daktari will say, I'll still ride on Daktari's quotes, mental health, they should take care of their mental well-being. Yeah.
Tuanja, an executive member of the Sports Journalists Association. This event is quite important for us as journalists. Remember, we are always at the front, but sometimes we are not remembered, and also sometimes we also forget ourselves. It is important that to put our mental health and well-being at the forefront to ensure that as we work and go out there and hunt for stories, we have the perfect health, and also we can be able to manage a lot of psychological. Remember, for journalists, we cover some of the traumatic events, and we can get the debriefing that is needed, and it comes at a cost. We also have mental health services being provided here. For the ones who want to do a follow-up later, they can also do it. And I would also like to encourage, especially my fellow female sports reporters and all the women in sports, to also come here. We have more services. They're checking on your weight management. They have breast cancer. There's also dental care services, mental health. Remember, being a female in this industry is not easy, and this is the perfect opportunity to know how you can be able to balance your work and your mental health.
Hey, thank you so much. I'm Dr. Mercy Oira from House of Dentistry. I'm so happy to be here. This is like one of the rarest opportunities to just partner with SJAC and provide dental services to the team, to all the members of the society and other people who are also present in the area. It's an exciting opportunity to just share about dental care and any challenges of their teeth that they have, and advise them accordingly on what to do to get a remedy. Yes, definitely. You know, you're our face when we are out there. You're the ones who tell us the news. You give us feedback about sports. We want you to also smile and have a confidence in your smile. Be happy with your teeth and not have challenges with your teeth. I mean, you can't work if you're in pain. And we want you to be healthy, first with your smile and your teeth and everything in your mouth and the whole body generally. We want you to be very healthy. So House of Dentistry is a dental clinic based in Westlands at the mall. And we provide dental care to the entire family, both adults, both children and adults and teenagers. We offer all kinds of specialized services, including braces, cleaning, fillings, root canal therapy, alignment of your teeth, and even minor surgery that is offered at the place.